Happy Twin Tuesday! It's only me today, but that's okay. I'm one half of the twins. And so real quick, while people are jumping on, reminder that we have our first Pathways meeting in the office tonight. So if you were looking for connection in your community, basically if you're parents or you think you want to be a parent in the future, you're a provider for women or families in the community, then you are more than welcome to join us at our Pathways meeting tonight at 6:30 at Atlas Chiropractic Center. It's free to attend. You can bring your kids, but I also will be streaming it into our private Facebook group. So if you can't make it, and I understand you can't always make it, then definitely comment and let me know, and we'll get you in the Facebook group so you can either watch the live version tonight or you can catch the replay. And we're going to be talking about some really cool topics. So I'm really excited about it and to grow the community with you guys. So today, I want to talk about something that I hear quite frequently out in the community and in my office, and I'm fired up because I'm here to empower women, especially my moms, my pregnant moms, and my postpartum moms, and when they're coming in my door or I'm hearing stories about how they're being scared, how they don't know they have options, how they don't know they can ask questions, they're not feeling supported, it really it burns me up. So let's talk today because you're pregnant, everything's going to go beautifully and right, correct? Birth and pregnancy, guys, is absolutely incredible and amazing, and one of the biggest things I've learned in the time I've spent working with my pregnant population is it's Mother Nature though. There's always a different plan than what we have planned. So discussing your options is really important. Knowing what maybe backup or second case scenario can happen is really important. Finding out who can support you through that process and just empower you as you make those choices is really important. Sometimes when we get to the end of our pregnancy, baby is not in proper position. And I absolutely understand that sucks and it's scary and you feel like you have no control and you're already protective over this one that you haven't even gotten to meet yet, and then you're going into your provider's appointments and they're telling you baby's not head down, there's nothing you can do, here are your few options, but is it going to end up in a C-section? And I'm not saying all providers do that by any means, there are some really good ones out there. But I would say that majority of the ladies who come across my path are in those scenarios, and it breaks my heart. Or I'm hearing their friends who are getting the same advice, and I'm trying to tell them and encourage them there are other things they can do. So that's what I want to talk about today, because how you get through this, whatever the outcome is by knowing that you have choices, knowing that you can ask questions, knowing that there are certain steps that you can take to take some of your power back, all right? So let's say you walk into your appointment and you find out baby is not in proper position. What options do you have? We have a few options actually, which is really encouraging, right? Number one, Spinning Babies. They're on Instagram, they're on Facebook, they have a website, Spinning Babies. I think it's spinningbabies.com. We all know how to use Google, Spinning Babies, all right? There are different exercises on there that they show you that you can do to help encourage proper position for baby, which would be head down. A lot of it is going to be upside down, so like inversion. Like think about your head is here, your butt's up here. A lot of it's going to be that inversion. Warning, you're probably going to get acid reflux with this. You're going to feel that heartburn. It's very uncomfortable, but this is something that you can do. This is something you can do at home, between your provider appointments, in the pool. That is something you can absolutely do to start taking action over trying to help with encouraging baby to get head down, okay? So check out Spinning Babies. See what they have on there. Another option is acupuncture. Pretty cool, actually. Acupuncturists in most communities have acupuncturists that will focus specifically on our pregnant and postpartum moms as well, just like we do in the office. And they help. There's certain points on your body that can clear that energy and help with baby being in proper position as well. All warning, I am not an acupuncturist. I refer out to a great one in the community. So if you want more information about that, just comment below and I can definitely get you in contact with that person. But acupuncture is another option. So we have Spinning Babies, spinningbabies.com. Check them out. See if you can get in the right position, which is going to be head down, booty up, okay? So Spinning Babies, checking out an acupuncturist that focuses on our pregnant population as well. Another option that your provider might have talked to you about is an ECV. What's an ECV? Right? I know. Basically, an ECV is you would go into a hospital, they would do an ultrasound to see exactly where baby is positioned, and the doctor is going to manually, from the outside on your belly, turn baby and try to get baby in that head down position. All right. There's a lot of information out there about ECVs on how you should feel about them, how you shouldn't feel about them, their success rate, all of that. Please know that they're an option. When you're in that position, please know that they are an option. The earlier you do them, which can be done about 37 weeks is the earliest, usually the higher rate that the baby will go head down, because there's more room still for baby to do that and get in that proper position, right? But know that during that too, you do have pain management options. So I really encourage you to talk to your provider that you're working with, talk to your partner, figure out what you feel comfortable with that pain management. Is it something you're taking orally that they recommend? Is it an IV solution? Epidural is a solution as well. So just know that you can ask questions. Ask all the questions so you feel comfortable in your decision, and sit there for some time and make your decision that feels comfortable for you and your family and your partner, because that's ultimately what matters in a lot of this. And by us feeling like we don't have control over making those decisions, we feel very helpless and not empowered, and that's just not fair at all. And again, know that you have options. So we talked about spinningbabies.com, acupuncture, and ECV, where you actually go into a hospital, they check the position and they help flip the baby, is an option, okay? And then, of course, the last one I'm gonna mention is see a Webster certified chiropractor. If they're a birth fit professional, even better. Just extra training for pregnancy and postpartum moms. And me and Dr. Chihana both have both of those at the office here. As a chiropractor and as a Webster certified doc, I'm looking at the alignment of your hips. Are they moving like they should be? Are they stuck? Because your uterus is in front here, right? It's free floating in there, and you have ligaments that are going to attach to those bones. If there's any misalignment in there, that can cause that uterus in the front to turn and those ligaments to turn and get really taut, meaning that uterus isn't free floating like it's supposed to be. So baby might not be able to get in the proper position. There's just too much stuckness on one side. So we go in, we do gentle adjustments for the mom on the bones. We work on the muscles and those ligaments to get them to release. And a lot of times, baby is successful at getting head down. We're not turning baby, we're just helping mom move better and helping that area move better so baby has the best chance of getting in the proper position. The earlier we know, the better, because then we can see you more frequently. Same thing with the ECV. There's just more space in there for baby to allow them to move and get head down, more comfortable with that the more time that we have. But there are all options. So if you're going and you found out baby is not head down, and you're only being told C-section, and you're just not comfortable with that, please ask questions to your provider. Please find somebody who can support you in your community. If you're dealing with that right now and you're not local, comment below and let us know how I can help find you somebody who can help empower you in this process. A huge part too is going to be mindset. If we're really scared and really controlled and we don't feel like we have any control and we're really stuck here, we're not going to be able to relax as much as we need to, and by anyone in our surroundings telling us to relax is not going to help. So some simple breathing techniques can at least help you start to reconnect to your body and your baby, so you can start to feel at home again, so you can start to calm down, to think about what are the questions you want to ask. Who can you ask? Are you asking all the appropriate people? Are you getting all the support you need? Okay? So just know that you have options, ladies. Remember, spinningbabies.com is a good place to start. Check out for a local acupuncturist who works with pregnant moms as well. And ECV is an option on the table for that. Webster certified chiropractor. And there is a difference. So if you're seeing your chiropractor and are not Webster certified, especially during this pregnancy time, especially if baby's head down, check out for a Webster certified one. If you can find a birth fit professional, even better, because we'll help support you a little bit more on that mindset as well, and some other different pillars. So ultimately, at the end of the day, what I want you guys to take away from this is you have choice. Ask questions so you can feel empowered in this process, and know that no one expects anything from you. You have to make the best decision for yourself. And I understand that can be really hard during pregnancy and motherhood, because everyone literally throws all their opinions on you. So if I can encourage you to do anything, try to ground yourself, create that space so you and your family are able to make the best choices, the best serve you guys. It doesn't matter about anybody else. They're not making the choice for you, okay? If you have any questions, comment below. I'm really passionate about this. Share it with your friends, just getting information out there. So I don't have women who continuously walk into my practice really upset because they're not told their options. Thank God they're here and they at least know some of their options. But if they never had walked in this door, would they have even known that maybe they could have just went upside down for a little bit or tried acupuncture and baby could have relaxed and gotten head down? I'm here to advocate for you guys, all right? I hope you have a fantastic day. Thanks for tuning in for Twin Tuesday. Soon, Dr. Johanna will be back, but she's at home, being a mama right now, which is pretty cool. All right, love y'all. Bye.